Hello everyone, Assalamu alaikum, good morning, good afternoon and good evening according to your time zone you are listening and watching me. Well, I am truly honored to have such passionate doctors, my fellows and future specialists for joining me today. I understand the challenges you face as doctors and students, which is why every session here is structured to be clear, guideline based and exam oriented without losing the clinical relevance. In today's class, I will break down the topic step by step so that by the end you feel confident, prepared and motivated. So as always, let's begin this journey of learning with clarity, confidence and purpose. Today I am in continuation of the topic Diabetes in Pregnancy NICE Guideline 2020. In previous lecture of this guideline, I talk about preconception planning, and now today I am telling you about gestational diabetes. Gestational diabetes mellitus is the most important FCPS as well as MRCOG exam topic. So stay with me till the end of this lecture. In gestational diabetes mellitus, we are going to cover risk assessment, then how do we test for gestational diabetes mellitus, and then how the condition is diagnosed, followed by once the diagnosis is made, how it is managed. Now first we will talk about risk assessment. If gestational diabetes is not detected and controlled, there is a small increase in the risk of serious adverse birth complications such as shoulder dystocia. Now we have to assess the risk of gestational diabetes using certain risk factors in a healthy population. Now what are those risk factors? In the next slide, I am going to tell you the risk factors which I have made in the easy form for you, in the form of a mnemonic that is bigger. So, at the booking appointment, we have to check for the following risk factors. B stands for body mass index. So, the BMI of 30 kg per meter square or more than this is one of the risk factor. Now, I stands for previous infant is macrosomic, weighing about 4.5 kg or more than that. G stands for previous gestational diabetes mellitus. If the patient is giving history of gestational diabetes mellitus in her previous pregnancy. Now another G stands for family history of diabetes, that is the first degree relative of the patient is having diabetes mellitus, which means that this is present in their genetics. Now E stands for ethnicity, and ethnicity with a high prevalence of diabetes. So all these 1, 2, 3, 4, 5 are making the risk factors. If these are present or even one single risk factor is present in the female population, then we are going to screen these patients for gestational diabetes mellitus. Now our risk factors remember easily. So this is going to make you happy, I hope, because with the help of this you are not going to miss any risk factor. So please remember the risk factors with the help of this mnemonic bigger. Now we are moving toward another slide. As you can see here, this is a very beautiful colorful diagram which is showing you the risk factors for gestational diabetes mellitus. B stands for BMI more than or equal to 30. I stands for infant weighing more than 4.5 kg. G stands for previous history of gestational diabetes. Another G stands for ethnicity, that is family history of diabetes. And E stands for ethnicity, this is at high risk group. And R stands for PCOS, other risk factors, or you can say the risk factors remember easily. So now we have to offer the woman with any of these risk factors what? Testing for gestational diabetes mellitus. Okay? So now another thing which is given in your NICE guideline 2020, that if patient came to you in OPD, in clinical setting, and she is showing you urine routine examination, so how you are going to see that whether glycosuria is present in that or not, and if present, how you are going to interpret and how you are going to take further step for the management of the patient. So, glycosuria detected by the routine antenatal testing. So now we have to consider further testing to exclude gestational diabetes in women with the following reagent strip test results. So what are those results? If glycosuria of 2 plus or above is present on one occasion, mean 2 plus or above on one occasion. So you have to screen that patient for gestational diabetes mellitus. And if glycosuria is present of 1 plus or above on 2 or more occasion, you can remember it in the form of going here and then going backward. If 2 plus glycosuria is present on one occasion, we are going to screen this patient for gestational diabetes. And if 1 plus glycosuria or more is present on 2 occasion, then the same holds true, that we are going to screen this patient for glycosuria for gestational diabetes mellitus. So further testing can help to exclude the gestational diabetes and thus re-ensuring the healthy outcome for pregnant women. So with the help of this diagram, you can easily learn the interpretation of. Now you need to remember certain points as well before proceeding to the gestational diabetes mellitus testing, that you have not to use fasting blood glucose, random blood glucose, HbA1c, glucose challenge test or urinalysis for glucose to assess the risk of developing gestational diabetes. Okay, so you need to remember these points. Now, the oral glucose tolerance test is a test for gestational diabetes in at-risk pregnant women. So we have just studied the risk factors for that, and now we are going to do the test for gestational diabetes. So we use 75 gram 2-hour oral glucose tolerance test to test for gestational diabetes in women having risk factors. Now you need to remember that the test is of 75 gram. This is not 50 gram. This is not 100 gram. This is your important exam question. Next, the important thing in which students, doctors sometimes get confused, that what is the timing, whether it is fasting 1 hour or 2 hour. So for OGTT, it is 2 hour. So please remember this point as well, that it is 75 gram 2 hour oral glucose tolerance test. Now, how the test is done? For women who have had gestational diabetes in previous pregnancy, how you are going to conduct the OGTT. So you can remember is at case 1 that among the 5 risk factor, the first risk factor we are taking out is the woman having history of gestational diabetes in previous pregnancy. You are going to offer her early self-monitoring of blood glucose. But if the patient can't do that and she is presenting to you in the OPD and she is giving history of the diabetes in previous pregnancy, we are going to offer her as possible as early after booking. Most importantly, in the first or second trimester, we are going to offer her OGTT. And if that comes normal, a further 75 gram 2-hour OGTT is again repeated at 24 to 28 week of gestation, because we have to screen the patient. This patient is at high risk of developing GDM. So how you are going to remember that if patient is giving history of gestational diabetes in previous pregnancy, we are going to do OGTT first at booking, and if that comes out to be normal, then the second test is repeated again at 24 to 28 week. So in this case, we are going to do it twice if the first one is normal, and if the first one is not normal, it is impaired, it is high glucose level, then the condition is taken out as the case of gestational diabetes mellitus till delivery. We are going to manage her in line with gestational diabetes mellitus. Now, what about the other 4 risk factors that are left behind? Now, apart from gestational diabetes in a previous pregnancy, if other 4 risk factors are present, then we offer women gestational diabetes mellitus testing 75 gram 2-hour OGTT at 24 to 28 weeks. Mean for the other 4 risk factors, only one time OGTT testing is done. And for gestational diabetes in previous pregnancy, 2-time OGTT is done if the first one is normal. So please remember, this slide is very important for your exam point of view and even for your OSCE, for your Viva by the examiner. Now, what are the tests of OGTT and how we are going to diagnose this? Please give attention to this slide. This is again very important slide. It can comes in the form of single best answer and even the EMQs. So you have to interpret the results of OGTT, that once you have done 75 gram 2-hour OGTT in which we take 2 readings. Fasting blood glucose, the level should be more than or equal to 5.6 millimole per liter. If you get fasting glucose of more than or equal to 5.6, you are going to diagnose this patient as a case of GDM. Okay, now in between these 2 readings we have got the word or, not and. Please, in MRCOG Part 2 exam, we frequently encounter such questions in which the RCOG get confused you by putting the word and between these 2 readings. So you have to choose the option that contain these 2 readings, but in between these 2 is the word or, or. Now, the second 2-hour plasma glucose level should be equal to or more than 7.8 millimole per liter. If the reading comes in this level, then you have to diagnose the case as GDM. So the memory hook for you people is that fasting is 5.6 and the 2-hour level is 7.8. So this is easy to remember, 5, 6, 7, 8, and thus the diagnosis is of GDM made. But the important thing I am going to repeat, that between these 2 reading, the word or you have to remember. So once the diagnosis of GDM is made, the next step is of management. What intervention are you going to take if the patient is having gestational diabetes mellitus? When women are diagnosed with gestational diabetes, you have to offer a review with the Joint Diabetes and Antenatal Clinic within 1 week. Now, we have to explain that the treatment includes changes in diet, exercise, and could involve the medicine, pharmacology. Now, we have to teach the women as well with gestational diabetes that how to self-monitor their blood glucose level. Use the same capillary plasma glucose target level for women with gestational diabetes as for women with pre-existing diabetes. So here I have brought a slide that is showing what are the target levels for measuring the plasma glucose level. This is same for gestational diabetes mellitus as well as for the woman having pre-gestational diabetes. Now, in this, the fasting glucose level should be 5.3 millimole per liter and 1 hour after meal is 7.8 millimole per liter, or 2 hour after meal is 6.4 millimole per liter. So as you can see here that we are taking one measurement of fasting and the other measurement of 1 hour or. So you need to remember that the target plasma glucose level can be taken in the form of fasting and 1 hour or 2 hour, and the levels are 5.3, 7.8 and 6.4 respectively. Now I need attention of all the OBGYN students and doctors on this slide because this is very important. Now you can note that in NICE guideline it is given about the fasting blood glucose at diagnosis. We are not here talking about 1 hour or 2 hour. We are talking about fasting plasma glucose at diagnosis, and in light of that what is the management strategy. The first case is here that if the fasting plasma glucose level is less than 7.0 millimole per liter, we are going to offer trial of diet and exercise for 1 to 2 weeks. Now, if the targets are not met for 1 to 2 weeks with the help of diet and exercise, we are going to offer metformin for this patient. And if the metformin is contraindicated or unacceptable to the woman, we are going to offer insulin to this patient. That is, if it is contraindicated or unsuitable, patient is suffering from certain side effects of metformin, we can offer her insulin. And at the end, if metformin is again not working along with diet and exercise, we are going to offer insulin as well. That is, at the end, if alone the diet and exercise is not working, metformin addition is also not working, we are offering insulin as well. So at the end, all the three measurements are added together. So please remember it as a first case, that this is going to be first case if fasting plasma glucose is less than 7.0 millimole per liter. Now we are moving toward the second case. In second case, if fasting plasma glucose is more than or equal to 7.0 millimole per liter, then we are going to start immediately insulin with or without metformin. But please remember, this is known as here that the diet and exercise formula is applied in all cases. We cannot minus this step. So the plus word is added here. Now this is going to be our second case. Now with the third case, what we are going to do? If the patient fasting plasma glucose at diagnosis is between 6 to 6.9 millimole per liter, but unfortunately the pregnancy is having some complication, and the complication is in the form of macrosomic baby or the polyhydramnion. So if we encounter such case, we are going to consider immediate addition of insulin with or without metformin, and again the plus addition of diet and exercise. At each step in all three cases, all the women are going to have diet and now I am going to show this in the form of a diagram flow chart, because with the help of that you are going to remember that easy. So let's have a look on that diagram algorithm. That management of gestational diabetes according to NICE 2020. Gestational diabetes mellitus, if once diagnosed, we have to offer all the women a dietitian referral plus diet and exercise. And now the question can be asked from you that what form of exercise I could do if female with gestational diabetes mellitus is asking from you. Then you have to tell her that 30-minute walk after meal is sufficient enough for such cases. Now again moving toward the fasting plasma glucose, if the level is less than 7.0 millimole per liter, we are going to give her trial of diet and exercise for 1 to 2 weeks. And if the target levels are not met, we can offer her metformin. And if metformin is contraindicated or unsafe for the woman, we can offer insulin. And if diet, exercise plus metformin does not work for this woman, then we have to offer insulin. Now the second case, that if fasting plasma glucose is more than or equal to 7.0 millimole per liter, we are offering her diet, exercise plus insulin with or without metformin. Again the same third case, if fasting plasma glucose level is between 6 to 6.9 plus the complication, then we are immediately considering the early treatment in the form of addition of insulin with or without metformin and diet and exercise as in all cases. Now you have to master the memory hook for this in the short form, that for all cases we have to offer the lifestyle modification, and if less than 7 we are proceeding stepwise, and if it is more than or equal to 7 we are straight away adding the insulin to the management, and if there is figure of 6 to 6.9 millimole but there is certain complication in the form of macrosomia and polyhydramnia, we have to treat the condition early. So that was all about gestational diabetes mellitus. I hope that I have break down the topic step by step so that the concepts are clear and easy for you, and now you can gain confidence in the topic of gestational diabetes mellitus and you can apply these topic in your day-to-day life, in your day-to-day OPD, and with the help of this topic the things are going to be easy for you. So till then, the next topic I am preparing for you all. Thanks for watching. Follow, like and share my channel, and I hope next time we are coming with the next topic that would be easy for you. Till then, bye. Allah Hafiz.